Alright, so I'm here today with Greg. Greg's coming in after a back injury from weightlifting. He was doing a deadlift, felt a pain in his back, went right into his buttock, and the pain traveled down the back of his leg, stopping right at the knee level. So, since he hurt his back, he's been having pain with things like sitting, lifting objects off the ground, bending forward, and he typically feels better with lying down. So right off the bat, just based on his history, we're thinking a possible disc issue, but we're going to do a little bit of a range of motion screen and then a couple of special tests to determine if this is what's going on. So first thing I'm going to have Greg do, I want you to bend forward towards the floor as far as you feel comfortable.
That hurts.
Does that feel like the same pain you have been getting?
A little bit, yeah.
Okay. Next motion, hands on your hips and bend backwards for me, please. How does that feel when you do that?
More relieving?
Okay. Any pain in the back, pain going down the leg?
No pain.
Okay. Can you bend sideways to your right?
That hurts.
So he's limited, painful that way, and then how about sideways to your left?
That feels more relieving.
That feels okay?
Yep.
Okay. Next we're going to do a test called the slump test to check for some dural tension, meaning tension on the spinal cord, any of the nerves traveling down the leg, such as the sciatic nerve. So I'm going to have Greg slouch. Good, keep your head up for now. Kick your right leg straight up in the air. How does that feel?
It feels a little irritated.
Does that feel like the same pain that you've been getting down the leg?
Not a lot, but a little bit.
How does it feel when you bring your toes up?
Yeah, that irritates it a lot.
And then you bring your head down?
Yep.
Same thing? Okay. Lower that leg down. Slouch again for me, please. Let's do the same thing now for the left leg. So kick the left leg up. Any pain?
No pain.
Toes up. Head down. How's that feel?
Feels good.
So positive slump on the right, negative slump on the left, since it did reproduce the symptoms on the right hand side. So next we're going to check his straight leg raise. So I'm going to start by passively bringing his right leg up. I want you to let me know if you feel any pain as I raise your leg.
Right there.
Right there.
Yep.
So Greg starts to get his symptoms at about 25, 30 degrees of hip flexion. Anything less than 60 degrees is considered a positive test for the straight leg raise. Just to make sure that it's not just a passive muscle tension that he's feeling. How's it feel on this side?
Just stretch.
So he's still tight, but he's not getting any of that symptom provocation. Just to make sure that it's definitely not going on from here, I'm going to dorsiflex his foot, and then I'm going to have you bring your chin to your chest to further rule out that there isn't any dural tension on his left-hand side. That feels fine?
Feels good.
Good.